A recent study from Cornell University finds 2 out of 5 New Yorkers with children choose not to work because of the price of childcare. Gio Battaglia spoke with researchers and childcare providers about the rising cost of care and the lack of providers in our area about the problem and got some ideas for their solutions. Gio.
Teresa, researchers at Cornell University say increases in state subsidies have helped stabilize the industry through the pandemic, but were insufficient to reduce inequities in access and quality. Russell Weaver is the research director at Cornell University and has played a big part in their research on childcare. He says the number of licensed childcare providers has declined.
When you start to get into the roots of why that might be the case, the natural place that we went to were working conditions for childcare workers.
The study found because of this, 2 out of 5 surveyed New Yorkers have opted to leave their job and stay home to care for their child. But it's not just because of the lack of workers.
So we asked why, what was the reason? And 75% of those persons said it was either because childcare is too expensive or not available in their location.
Weaver is hoping the research will be used to help 2 pieces of legislation that will be introduced in the state Senate.
The senator's bill currently asks for a $1.2 billion annual permanent investment into the childcare workforce that would be distributed to all childcare workers across New York State, effectively creating a public-private partnership between the state and licensed childcare providers to ensure that workers at those facilities would earn closer to a living wage.
Here in Rochester, the Child Care Council on Blossom Road showed me data of a 4-year child care capacity trend, revealing our 9 area counties lost about 3,000 child care spots, a number that has been increasing each year.
With the pandemic, we've seen some changes. We've also seen an uptick of many people having more children. So there's a need. It's such a need, and we're at this crucial time that we have an opportunity to make those investments.
In the meantime, both Weaver and the Child Care Council recommend utilizing nearby resources to give your child the best possible care.
We can provide referrals to licensed child care programs, and those are different modalities. It's not just centers, it's family child care, group family child care programs, perhaps summer camps, nursery schools. Those would be like legally exempt.
And the Child Care Council also notes they also work directly with child care programs to be able to provide support for healthy nutrition, another thing that can be costly. We have a list of resources for child care aid on our website, rochesterfirst.com.